According to the CDC, the prevalence of Fragile X syndrome in males is approximately 1 in 4,000 and 1 in 6,000 in females. To learn more, we went to CHOC Children's Hospital in Orange County, California, and spoke to Dr. Neda Zadeh, who is board certified in clinical genetics, clinical molecular genetics, and in pediatrics.
Fragile X is the most common cause of hereditary intellectual disability. It's caused by a disruption in the Fragile X gene, which is also known as FMR1. Fragile X syndrome is caused by an expansion of DNA, which is also known as a repeat, in the beginning part of the Fragile X gene. All of us have this expansion or repeats of DNA. They're also known as CGG repeats. So in people that are unaffected, they can have between 4 to 45 repeats. In patients that are premutation carriers, they can have between 55 to 199 repeats. In patients with full Fragile X syndrome, they have 200 or more CGG repeats. And it's important to know this because depending on the number of repeats, we see different features. Some of the common features that we see is definitely developmental delay. So not walking on time when we would normally expect a child to, and not talking on time. A lot of the physical features that we see in children with Fragile X may not be as obvious until people get a little bit older, maybe mid-childhood to early adolescence. Some of the physical features that we can see tend to be slight differences of the face, maybe a longer or more narrow face, maybe larger sized ears. Sometimes individuals can have joint flexibility that's more pronounced. Some children can have seizures. The other big aspect of this is behavioral issues. So many individuals with Fragile X syndrome have intellectual impairment and also some autistic-like features. And by that, I mean that maybe some social shyness, poor eye contact, difficulty with sensory processing. While there's no cure for Fragile X syndrome, there definitely is supportive therapy that we find an earlier diagnosis is always a good thing because it allows us to make certain that children are getting good speech therapy, occupational therapy, any sort of supportive measures that really helps try to move them along developmentally and help them reach their best potential. This is a condition that affects the entire family. Once we have a child that's diagnosed with it, it opens up possibilities for everyone else in the family. We may find that grandparents and siblings are also carriers. We may find that an aunt has premature ovarian failure. We may find that cousins are pregnant and having affected children. So it becomes a complex discussion, but it also becomes something that we aim to not only take care of the child, but also to take care of their family.
The doctor discusses the diagnosis of Fragile X syndrome.
We can take blood, a very small amount of blood, saliva, or skin from the inside of someone's cheek, extract the DNA from it, and look directly at the FMR1 gene, and look to see the number of CGG repeats that that person has. It's very accurate, and we can tell someone if they're a carrier or if they have full Fragile X syndrome. This is a condition that affects both men and women. It occurs in all ethnicities, and because of this, it's a very important topic all over the world where we see a lot of support groups that have popped up and a lot of research that's taking place on almost every continent. The research that is being performed now is various on multiple levels. The ultimate goal is to improve quality of life and maybe one day have a way on a cellular level of fixing the genetic problem, because currently we're not able to do that. And to also have a better understanding than what we do right now as to what the protein actually does in the brain and how we can be more helpful to our patients, as well as carriers who have other features.